Now, public comments on amendments to the Health Act has been extended for another 7 days. They're concerned the move will threaten people's constitutional rights as well as their freedoms. One of the concerned groups is the Family Policy Institute. Let's chat to Executive Director Errol Naidu. Mr. Naidu, thank you very much for your time this morning. Now, you're among a growing number of people and organizations that have strong views on the proposed amendment to the National Health Act. Now, let's start with just Regulations 15A and B, which tackle quarantining and isolation. What is of concern to you in this particular section of the regulations?
Well, firstly, we think it's unnecessary that government has to transfer the regulations or the extraordinary powers that it's granted government in the state of disaster to put that in normal legislation like the National Health Act. And this gives government extraordinary powers, as I said, even in a non-state of disaster, to compel people to medical examinations, to compel people to take medication against their will, to compel people or, to isolate in their home. And if a person is living with 4 other people in a home, if those 4 other people cannot move out of the home, that person has to move out. And if they don't have a facility, then they are compelled to go to a state-run facility to be isolated or quarantined at an indeterminate time. It doesn't put any time on how long that person has to stay in a state-run facility. And we've got to be honest with ourselves here. We know the state of our hospitals and clinics today, and many people are concerned about the state-run quarantine facility because they don't know the state of it, and would it be a threat to their health?
Another concern that some have had is around the access to internet that is required if one is to self-isolate. It seems that you must have access to internet. You also need to have a phone that allows you for daily reporting. It's one that's very concerning for some because it presupposes that people have access to the internet or even have phones, which isn't the case. What did you make of that? If they say there are options to either isolate at home, and then if not, then you'll be compelled to go to a specific hospital that the government has decided upon. What did you make of the whole internet and phone situation?
Yeah, I think, all of these regulations, firstly, are draconian. It's unnecessary because to make permanent these kind of regulations in the National Health Act is unnecessary because government has the Disaster Management Act available to it anytime. And so if infections get out of control and hospitals are overflowing, government can activate the Disaster Management Act, the state of disaster, and use the powers granted it to maintain and manage the pandemic. But yeah, they're giving themselves powers in the National Health Act will be permanently, and they're making all of these demands on people that are unreasonable and irrational and illogical. Because, we know the conditions that most South Africans live in. People live in shacks, 1-room shacks. And how those people, and there's 5, 6 people living in that shack, how are they going to isolate? Where are the other people going to go to? Where are they going to get the thermometers and all these other things that government requires? All of this is coming from the World Health Organization, and government is taking its directive from the World Health Organization because they've issued this global pandemic treaty that will give them control of every nation in the world, their health issues. We are a sovereign nation, and I think government needs to consult with people like they're doing now in this comment period, and there's problems with the comments as well, because they've just changed the government gazette yesterday. The Minister of Health signed published a new government gazette and signed it on the 14th of April with new email addresses and comments. And so people are confused. There's different notice numbers, and the one has been replaced the other, but people are still commenting on that. There's over 400,000 comments that have been sent to government so far. A lot of them have been deleted without being read. People are sending that to me, because we created a site called sapublicspeaks.co.za where people can easily email the Department of Health. But they're sending these notices back to me saying that the government is receiving it, or the Department of Health is receiving it, but they're deleting the submission without it being read. So people are panicking, really, because these regulations in the first place is so draconian. It is going to suspend and limit the rights and freedoms of ordinary citizens and make them huge demands on them. I mean, one of the things is if you can't isolate, government then has the authority to send the police to pick you up at your home and take you to a state-run facility.
Yes, with a court order.
With a court order, and government can spy on citizens. Under this guise of protecting lives and managing the pandemic, if you just suspected of being infected with a notifiable medical condition, but it's not clearly defined either, just suspected that you've been in contact, and that is not specified either, then the police can come and collect you and put you, and then government also put surveillance on you and track your movements. This is highly unconstitutional and irregular. And you know what would happen if this is passed? We would turn into China. People would lose their rights. The Bill of Rights would be suspended for every citizen, and government would have extraordinary powers to control and limit the movements of ordinary citizens based purely on what they, the Minister of Health is granted sole discretion to decide what is a health crisis, what is a notifiable medical condition, all of these kind of things. So it puts too much power in one man's hand,
I'm quite
and it's
concerned.
frightening.
It's very, very frightening. I'm actually quite concerned about what you stated there, that people are making submissions and somehow the health department is deleting these. It's very concerning because people would want at least government to have their views before this is finalized. Perhaps we should speak to the health department to get clarity on that. Perhaps there's some sort of an error in the system. But then another point that you mentioned that I want to take you back to is the amendments when you say that it's patently unnecessary because particularly government retains the authority to activate the Disaster Management Act. But this is something that you differ with some other organizations who say they should never go back to the Disaster Management Act. They need to find other mechanism to deal with this pandemic. They cannot keep going back to the Disaster Management Act.
Look, I agree, but what other nations are doing, and you around the world, they're all moving into this system of living with the virus, learning to live with the virus, and managing it without affecting the economy, lockdowns, people's health and movements and all kinds of things. And that's where we should be moving. So this extension, this 30-day extension after the Disaster Management Act or the state of disaster ended on the 4th of April, the few regulations that are still in place is going to end on the 4th or 5th of May. And when that comes to an end, that's the end of it. So the state of disaster comes to an end. The Department of Health should be issuing directives on how people should be managing, giving updates on the infection rates and all of that. And people, people with high risk can wear masks if they want to. People that are healthy, that had the virus and now have natural immunity, they don't have to. But we should begin to manage and live with this virus. What I'm saying is that there is a huge outbreak and the infection rates is going up like in the first and second waves. And the hospitals are filling up. Government does have the Disaster Management Act that they can activate if they need to put certain measures in place, like stop the sale of alcohol, or they need this or that. They have it. What I'm saying, they have it and they can use it. Not that they have to do it, but they have it. So the question is, why are they taking these extraordinary powers in the Disaster Management Act and making it permanent in the National Health Act, so that they can control and limit people's freedoms and use all these things that we mentioned, surveilling people, forcing them to take medication, their movements. If people coming into the country must show a negative PCR test or have a vaccine certificate. Churches has been decimated by the lockdowns. People couldn't go to church, and today is Good Friday. People should be let into churches, to normal capacity, because that's what's happening in other nations. You look at the football stadiums, they're all packed. Everything is back to normal there, so people are managing this. Why not South Africa? And why our government is demanding this permanent powers to control people, even in a normal living, no state of disaster? They want these powers to use it whenever and however they deem necessary or fit. So this is frightening for the freedoms and the rights of South African citizens. This is the most draconian piece of legislation I've seen since 1994, and it has freaked people out across this country. Hundreds of thousands of submissions are going from organizations, ordinary people, church groups. Everybody's saying no to this amendment.
Let's hope then they
do. The state of disaster must end. The regulations must end in May, and people must go back to normal living. We must we need to recover. People need to recover. Schools need to recover. And the economy needs to grow. I think government must leave that up now to civil society to do all those things, to even our, what is the word? My mind just went blank now. But our tourism sector suffered a lot. So many people lost jobs, record unemployment and all of that. All of that need to recover, and we can now, as we move into normal living, and putting certain things in place to control and manage the virus. But what government is suggesting here is completely unnecessary. It's unnecessary, it's unconstitutional, it is frightening. No government, never mind how good that government is, should be given such extraordinary powers over its citizens.
Yes.
And then, of course, there's the labor relations.
Unfortunately, we've run out of time. I wish we could talk about this a bit more. But let's hope that citizens do participate in this exercise and actually make those submissions, because it really is up to them. What they want is what they will get. So hopefully they will participate. Thank you very much for your time. That's Family Police Institute's Executive Director, Errol Naidoo.